A hospital, I consider that a safe place. That should be somewhere where you can go and not worry about being attacked, whether you're a patient or a nurse or the janitor or the surgeon. You shouldn't have to worry about disruptions in a hospital. A hospital is where people go when they're vulnerable. A hospital is where people go when they need help. So, it's important to realize that. So it's important that healthcare workers and everybody realize that the options that are available to them. But I think it's also important that people realize that if you do these kind of things in a hospital, you're going to get hammered. Paula, the way I got interested in this was several years ago. Linda Robinson, who's a registered nurse in my community, came to me, and she worked in the emergency room at our local hospital, and she was very concerned about what the assaults and really with their heroin problem. I think it was really getting out of hand. So she came to me about drafting legislation to help protect nurses in the emergency room. And so we met with lots of folks about it. We met with law enforcement, prosecutors, chairman of the Judiciary Committee, and we came up with what we thought, I don't want to say it was a solution, Paula, because you're not going to fix society's problems with laws, but we did come up with what I think was a good law. I feel like it was a good solution. A lot of people said, well, John, why didn't you make it a felony? And the reason we didn't make it a felony was because simple assault, and remember, with simple assault, there doesn't have to be any serious physical injury, is punishable up to 1 year in the county jail. And I'm also a retired jailer. I've done a lot of things. And most people, I can't remember anyone ever being sentenced to 1 year for simple assault. So what it did is it gave local officials the flexibility to handle these cases the way they wanted. And if they wanted to use the hammer, which I hope they do, the hammer was available. I don't know that passing additional laws will help. I think the laws we have in place are good. I think that people need to realize what laws are available to them: county attorneys, county prosecutors, police officers, hospital administrators, rank and file nurses, because the legal options, I think, right now are there. I would be happy to do more if there's something. My area is the criminal law, and I've served on the Judiciary Committee, which is, I'm not on the Health and Welfare Committee. I'm not on the state and local government committee. So if there's anything that can be done in the realm of the criminal law, I would be happy to do it. As far as getting involved in other things, I would support that and vote for it as a legislator, but I don't see myself taking a leadership role.